Many of you may be familiar with mannose or d-mannose that you often find in health food stores. Fairly common, fairly inexpensive, used for a myriad of treatments, primarily used in regard to urinary tract infections. However, mannose in this pilot study, I want to emphasize that, pilot study done in animals, meaning eventually if these results in this particular study carries out to humans, then that'd be very cool. But in the meantime, it shows incredible potential in regard to this one particular study utilizing animals. Mannose was shown to interfere with the cancer cell, variety of cancer cells, different types of cancers, used to interfere with the cancer cell's ability to utilize that very important nutrient to the cancer cell, glucose. So let us proceed with this small review in this small pilot study done in regard to animals. Also, this is utilized in abstract, meaning I don't have the information available until a full study is published in regard to the amount of mannose utilized in the food supply of the animals, nor the length of time. However, with that in mind, let us proceed. Sugar supplement slows tumor growth and can improve cancer treatment. Tumors use more glucose than normal healthy tissues. However, it is very hard to control the amount of glucose in your body through diet alone. In this study, the researchers found that mannose can interfere, this part's important, with glucose to reduce how much sugar cancer cells can use. The researchers first examined how mice with pancreatic, lung, or skin cancer responded when mannose was added to the drinking water and given as an oral treatment. They found that adding the supplement significantly slowed the growth of tumors. It did not cause any obvious side effects. To go a little further, they wanted to use it in conjunction with two very popular chemotherapy drugs. They found that mannose enhanced the effects of the chemotherapy, slowing tumor growth, reducing the size of tumors, and more importantly, even increasing the lifespan of some of the mice. All right, now, how does it do what it's doing? With this, we're going to go to the abstract. Again, full study is not published as of yet, so we're working from the abstract that we have here. To quote the researchers, we then show that these effects also occur in vivo in mice following the oral administration of mannose without significantly affecting the weight and health of the animals. Mechanistically, mannose is taken up by the same transporter or transporters as glucose-3, but accumulates as mannose-6-phosphate in cells, and this impairs the further metabolism of glucose in glycolysis, the tricarboxylic acid cycle, the pentose phosphate pathway, and glycan synthesis. With that technical part out of the way, it gives you a little bit of insight on how mannose does what it seems to do. So, to end the research right here, again, work from the abstract, we have a little bit of a caveat from the researchers. Although these results are very promising for the future of some cancer treatments, this is very early research that has not yet been tested in humans. Patients should not prescribe mannose, as there are real risk of negative side effects that haven't been tested for as of yet. They want to play it safe is what they're saying. It is important to consult with a doctor before drastically changing your diet or taking new supplements. And to end the caveat there, to what appears to be research that has incredible potential into a fairly common, inexpensive sugar, in this case mannose, which can have profound effect of interfering with the cancer cell's ability to utilize glucose. And that is a pretty strong breakthrough altogether. So with that in mind, hope you find this information of use. Thank you very much for listening as always, and look forward to seeing you all again next week. See you then. Bye.